Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Today I want to continue with our Journal Club series and really talk about kind of going back to the start of where we had definitions of pharmacy informatics and the role of the pharmacy informaticist, kind of revisit that and talk about some of the landmark articles that have been published that talk about this topic. So let me bring up a presentation and we'll talk about 3 articles. And what we'll do is we'll start with one that I've discussed before, which is the statement that was put out by ASHP that really seemed to recognize pharmacy informatics as a specialty area of practice for pharmacists. So this was based on a meeting that occurred in 2006, and this was published in January of 2007. I referred to this article before, and it talks about what pharmacy informatics is and the fact that it's a subset of medical informatics. And this statement I've said exactly before from this article: pharmacists must use their knowledge of information systems and the medication use process to improve patient care by ensuring that new technologies lead to safer and more effective medication use. This is where I got it from, and this is really a good definition for the role of the pharmacy informaticist. A follow-up to this article or this statement was the next ASHP statement that was published, and this was on clinical informatics, so not specifically on pharmacy informatics, but kind of the broader topic of, or the broader area of clinical informatics, which would include, as we talk about health informatics, medicine, nursing, pharmacy, and other disciplines. And the statement really focuses in on pharmacy informatics and talks about the pharmacists who practice clinical informatics must collaborate with other healthcare and information technology professionals. And so we're talking about collaboration between different disciplines. But again, the role of the pharmacy informaticist revolves around their knowledge of pharmacy practice. So you have to be a pharmacist first, know pharmacy practice, and then get into safe medication use, clinical decision-making, and the improvement of medication therapy outcomes, combined with their understanding of the discipline of informatics and HIT systems. So you have to know the concepts of IT, information technology, but you have to know pharmacy and pharmacy workflow. And this is restated in this statement from 2016. In between is this article that was led by Dennis Tribble, one of the pioneers of pharmacy informatics, and titled "With Their Pharmacy Informatics." So where is it and what is it? And he goes into talking about this new discipline of pharmacy informatics, a specialty practice within pharmacy. And he lists out the skill set that he believes we need to have to practice as a pharmacy informaticist. So number 1 is knowledge and understanding of pharmacy practice. Okay, and this is consistent in what we've been talking about all along. Next is knowledge and understanding of automation. So automation, so it's information technology, it's the management of data, but we also talk about technologies applied to the medication use process. So we need to talk about automation. You need to have good project management skills. We've talked about that before. Change management skills. So all of these new technologies that are implemented are changes, they're disruptive to our normal practice. And once these systems are implemented, they're updated, upgraded, and changes still occur within each system. And so you have to be able to manage all of that. Analytic skills, data analytics, communication skills are extremely important in any discipline, but obviously also as a pharmacy informaticist. Understanding of basic software and database design, and again, Dr. Tribble emphasizes that we don't need to be programmers per se, but we need to understand the basics of software and database design. And we have to have the ability to follow program logic. So we don't have to be programmers, but we need to know the concepts. We need to have familiarity with basic data management tools and familiarity with automation devices that are currently available. So we need to know the technologies currently applied to the medication use process, and also be able to identify gaps and where we might apply new technologies. And then we need to be familiar with informatics standards and initiatives. So we've talked before about HL7 and RX norm and SNOMED and controlled vocabularies and interface standards, and you need to be familiar with all of these to really know pharmacy informatics. And finally, risk analysis skills, and basically this refers to finding out the risks of implementing a new system, and there's something that's called FMEA, or failure mode and effects analysis, something that you can do proactively, look at a process, look at where it might fail, put in safeguards before you even implement the technology to safeguard against any types of failures, and hopefully when you implement the system, you'll implement it in a safe manner. And then acquisition and request for proposal, RFP skills. When you're going out and getting a new technology, let's say automated dispensing cabinet, you need to go out, research all the vendors that are available, be able to compare their products, right? Have them write an RFP. So go out there, have your institution request a proposal from your top vendors, and then compare those, rank those, and see who's really offering the best package. And that's the one that you're going to go with. So you need to be able to evaluate those vendors. And that's basically a synopsis of what's said or what's covered in this article. I would encourage you to read this article in depth. I've just gone through the headings of the different skills and areas that Dr. Tribble says should be most important for the pharmacist to, who wants to specialize in pharmacy informatics, to be able to possess those skills and that knowledge. And so go ahead and take a closer look when you have time. This will really help you if you're still trying to figure out exactly what pharmacy informatics is all about and what you need to know and learn to be a good pharmacy informaticist. This will help you along that path, along with the 2 statements from ASHP. If this was helpful for you, please like the video and subscribe to my channel. And I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes, and I hope to see you next time. Take care.